I'd like to talk about concussion and mild traumatic brain injury on this show. It's a huge subject matter. It's very complex. I'm just going to offer some of the simple solutions that we do in my office, and I'm going to talk about 4 cases, 4 people that had concussions from various causes and what we did to help them. Fortunately, all 4 have resolved, so I want to talk about what we did here. Here's the protocol that I use, and again, this list is hugely expansive. These are just some of the things that I use in my office, okay? And as I get into the list, just keep in mind, if you just had a concussion, if you need to be checked, if you need to go to the ER, if you need to have a scan, have to have your brain looked at, MRI, CT scan, whatever it is, go do that. Do your emergency things to make sure you don't have a brain bleed or something else going on or a fracture. So make sure that you get medically checked, and then we can get into it if there's any residual symptoms after scans are negative and you don't have a brain bleed and so forth. Okay, so the first thing I definitely want to talk about is low-level laser. And I've talked about laser many times. So literally, my laser that I use, this low-level laser, can be used on the brain. And I use this on the head and the brain, and I've done so for 16, 17 years now. So you're going to see in these 4 cases that I'm going to be talking about how low-level laser therapy, cold laser, non-thermal laser works really well in these cases. So that's number 1 on our list here is laser. Now remember that all therapeutic lasers, they can have different powers, and some of them cannot be used on the head. I stayed away from my eyes, as you can see. I didn't have the protective eye glasses on, but I will use those in my office just so I could show you using my laser around the head. I'll put on the safety goggles as well. That's the only thing about even low-level lasers, you can't shine it in the eyeball. Okay. Secondly, we talk about nutrition and water. Now, if somebody is concussed and they have a mild traumatic brain injury, we tend to forget, we tend to be fatigued, we tend to be sleeping a lot depending on the severity of the injury. We're not in our regular regimen, we're going to forget to drink water. It's a simple thing. So if I have a caretaker coming in with someone else, we will talk about things to make sure that they have a list of things to do, that somebody can watch out and make sure that they're getting something as simple as water into their body. Dietary-wise, it is simple. You need antioxidants. Antioxidants. A concussion is a brain bruise, if you will. It's a sprained, swollen ankle that swells up like this. You want antioxidants to battle some of the inflammation that's going on. Lots and lots and lots of vegetables, as many vegetables as people can take in. Next is taking care of the spine and considering a chiropractor. So very quickly, your brain works by receiving electrical impulses from the muscles and the nerve endings buried in the muscles and joints all around your body, specifically at high concentrations around your spine. So when we're doing spinal work and muscle work and joint work, we are increasing the electrical activity to the brain, and we're trying to make those synapses and the brain cell communication stay strong and stable during that environment. So a slow but steady increase in the amount of spinal work and chiropractic care is the next thing you can do. Supplements we're going to touch on in just a moment, but there are very specific brain and anti-inflammatory supplements that we utilize for help, and I'll give that list in just a moment because I know some of you won't make it to the end of the show, so I'll talk about supplements. Sleep, of course, sleep and rest. Look at that and try to assist people, or if you haven't had a concussion, just follow the basics. Try to stay on a sleep cycle. Try to go to bed at a certain time. Try and to get up at a certain time as well. You might find that you need more rest early on in the stages after a concussion or mild traumatic brain injury. With exercise, general physical exercise, use caution. Don't exercise until you get clearance from whoever's looking at you, medical physician, physiatrist, physical therapist, chiropractor, whoever's watching over you. Make sure you get clearance about just general physical exercise. It could be as simple as walking or some cardio exercise weights. Titrate that up slowly. If you do too much too quickly, that can overwhelm the system. I've seen it happen many, many times. Any practitioners out there that deal with people with concussion and mild traumatic brain injuries have seen that many times, where if you engage in too much exercise too quickly, that can be a problem. Of course, one of the scenarios is everybody talks about do not try at all costs not to get a second brain injury while you're recovering from the first brain injury. That's the issue with contact sports, is sending somebody back onto the field too soon, right? Okay, and then last on our list is stress, meditation, mindfulness, relaxation, yoga, all of those things in that category, because when someone has concussion, mild traumatic brain injury, and they're in a stressful environment, and they might have extra stressors, oh, I can't work right now because I can't focus and concentrate. Oh my gosh, what can I do about the family? I need to get to school. More about one of those cases and that in a moment, about a college student who ran into that. So we need to make sure we're reducing the stress chemicals on the system. That can definitely, if the stress chemicals kick up, it's going to inhibit healing and flare things up, and I've seen that happen way too many times. So that's a list of things that we utilize in my office environment when we're dealing with people with concussion and mild traumatic brain injury. Before I get into the cases I want to talk about here, is I want to go over the supplements. So let's take a look at the brain-based supplements, remembering first that a couple of things. Number one is you can't out-supplement a bad diet, right? So if we're not getting good natural foods into us with lots of vegetables, particularly in a situation like this, you're not going to be able to out-supplement yourself out of that. So just keep that in mind. And secondly, never take any supplements until you check with your doctor first, especially if you're taking any medications or you have a diagnosed medical condition. Anything that I'm talking about here, check with your doctor first. You betcha number one on our list is omega-3 essential fatty acids from fish oil. Some of the research articles I'll share with you in a moment are very, very clear. This is the time that you're going to want to be taking your omega-3s. So dosages for that can be anywhere from 3 to 5 grams per day, or 3,000 to 5,000 milligrams per day. You have to know how to look at a label of a container. You want to make sure you're following all the rules, that it's been third-party tested, it's pharmaceutical grade, non-detectable traces of mercury, PCBs, and heavy metals. So you want to buy a brand that is talking about these kind of things. If you're taking a gel cap and it says 1,000 milligrams on the front of the label, you're probably not getting 1,000 milligrams of the fats that you need, the EPA and DHA. You got to flip the label over, look at those numbers, add them up. If you want 3 to 5 grams, and by the way, why 3 to 5 grams? Well, again, if somebody's 100 pounds, they're going to need a little less. If they're 250 pounds, they're going to need a little bit more. That's why we do that. Again, get guidance on that. And remember, you have to check with your doctor if you're taking a blood thinner medication, specifically with omega-3s. Secondly, you have to take some cofactors that go with omega-3s. Cofactors are antioxidants that protect the oxidation of fish oil, but they're also good for pulling out some of the oxidants, if you will, free radicals in your brain. Combination of B, C, E, CoQ10, alpha-lipoic acid, and the list goes on. We have a product that in our office that has all of that in one little tablet, so that makes it pretty easy. So that's number 2 on our list. Number 3, of course, is vitamin D. Now, vitamin D, it's nice to know what your level is. Just so you know, and I've done many, many shows on this before, I have yet to see one person who's not already supplementing with vitamin D that has an adequate level of vitamin D. So a maintenance dose, if you know what your level is, a maintenance dose could be 5,000 international units per day. It can be 10,000 units per day or even 15,000 international units per day if you're low. Again, check with the practitioner that you're working with. And with mild traumatic brain injury, if you're taking 5,000, you up that to 10,000 per day. That makes sense. Again, checking with your practitioner on that. Next, for sure, is definitely magnesium. I've seen some amazing things happen with magnesium. Magnesium for the brain, specifically after concussion and mild traumatic brain injury, has worked so well. The dosages there can be anywhere from 300 to 900 milligrams per day. Again, that can be body weight determined. Somebody smaller, 300 milligrams, somebody bigger, 900 milligrams. You also want to titrate up slowly. I've done shows on magnesium. Less expensive ones at the store like magnesium oxide I don't recommend, and people in the know recommend other forms of magnesium as well. You can check my website and other shows that we've done on this about magnesium. Curcumin. Curcumin, the active ingredient, the antioxidant, anti-inflammatory in turmeric. Curcumin you can take as a supplement, 400 to 600 milligrams 3 times per day in the middle of this when you're healing your brain, probably less than that when you're all said and done as a maintenance dose, maybe once per day instead of 3 times per day. The next one is resveratrol. Resveratrol is the antioxidant in red grapes. So that's the benefits of red wine, but the main benefit there is the resveratrol from the grapes. 50 to 500 milligrams per day is what some people recommend. I have a supplement in my office that combines the curcumin and the resveratrol together, so to make that easier for people. And then the green tea. Green tea, you've heard about this. Green tea has that potent antioxidant, anti-inflammatory called EGCG, epigallocatechin-3 gallate. Okay, that's the name of the antioxidant. So you can drink 3 or 4 cups of green tea per day. However, if it's caffeinated, you have to limit that. And some people don't like tea and they don't like green tea, so you can take a supplement that has EGCG, and if you take that, you can take 300 to 400 milligrams per day. Wow, that was a list of supplements that you can take that helps your brain after a concussion, mild traumatic brain injury, and so forth. A lot of these supplements here, because I've talked about these in other shows, these are just good brain-based supplements anyways. I've given you some levels here that might be a little bit more when you're in a situation post-concussion or post-mild traumatic brain injury, and then you can take a little bit less over time, although I do recommend for most adults they're taking at least 3,000 milligrams per day of omega-3 fish oil. By the way, 3,000 milligrams per day is a combination when you add EPA and DHA. You add them together to get to that 3,000. Okay, next up, I'm going to talk about 4 of my patients that had concussions and what we did to help them. So stick with me here. The first one was a 47-year-old chiropractor. He got in a highway speed accident. And luckily for him and everybody else, they walked away from the accident, but he wasn't feeling so good after the accident. He was knocked unconscious. He doesn't know how long he was driving himself. Airbag deployed, dazed and dizzy immediately, ambulance ride, his blood pressure was really high, he was backboarded, CT scan of the neck was fine. It was kept overnight in the hospital, which was appropriate. He was exhausted, dizzy, unsteady, still dazed, very emotional. These are common after concussions, mild traumatic brain injuries. Explosive anger was afterwards, weak and sick for a few days, missed work, and so forth. He started receiving some treatments from other practitioners, electrical muscle stimulation, and so forth, but he still had memory loss, had difficulty working, difficulty doing the other things that he did in his life. So I got called in after some time, and I had laser. And the folks that knew me said, can you come in and help? I said, well, we'll give it a shot, okay? So one of the things that I did is I started right away on laser when I saw them, and we did chiropractic adjusting. Now, on part of my analysis, we make determinations if necessary, if one side of the brain is affected more than the other side of the brain. If that is the case, if there's a little bit of an imbalance, we might increase treatments on one side of the body or with laser to affect more of the opposite side brain. If more of the brain injury was, say, on the right side, I might choose to laser the right side of the brain more, or the left side of the cerebellum, or treat more of the opposite side of the body to fire those electrical impulses to the opposite side brain. That's what we did in this case. I gave him a variety of balance exercises to his tolerance. We ramped them up slowly over time, the difficulty of them, that is. And we were doing the laser. I was working on him for once a week. This is now a year later, so this was in 2016, this injury. So 1 year later, he had the short-term memory, focus, and concentration had improved 90%. Emotional outbursts were way better. He still had some short-term memory difficulties. Obviously, a lot of neck and shoulder pain prior from an injury of that intensity. He still had some left-sided facial head symptoms, which was 90% better. So then 2 months later, 2 or 3 months later, he was just about 100%, 95 to 100%. So he was over a year, probably a year and a third, year and a half before he fully recovered from all of his brain-based symptoms. But he's doing really well now. So it turned out well. Okay, the second case, I actually did a brief show on this. You can look this one up. So this is a 71-year-old male. This was right at the beginning of COVID, just before, I guess, in history now, in history of humankind, we now have pre-COVID and post-COVID time frames or something like that. Anyway, so just before COVID hit, he fell down. This is February of 2020. He fell down a flight of stairs at home, hit his head, knocked himself out. Okay. So came to, wife took him to the hospital. He got a brain scan, which he needed. They did see some fluid in the brain, but not enough to do any surgery. So they sent him home. He was miserable. For 6 weeks, he was miserable, stuck at home. Couldn't work. He was still working full time. Couldn't work. Getting out of bed was a chore. Could barely get dressed. No energy, fatigue, no appetite, no focus, concentration. Couldn't look at a lighted screen. Couldn't watch TV. The whole thing. So lots of concussion symptoms in this case. 6 weeks later, he and his wife remembered me. They had seen me in the past. So the wife called and said, "Hey, can you help?" I said, "Well, I don't know. I think I can. So I got this laser thing. We can put him on a protocol and see what happens." Okay. So he comes in. His wife took him in because he couldn't drive. This is again 6 weeks after the injury, and he also, when he fell down a flight of stairs, he broke his collarbone. So his collarbone is sticking up, like Frankenstein out of his shirt. He broke some ribs, so he's pretty uncomfortable. He could only sit on my table. So here's what I did. I used my laser on his brain. We did that 3 times a week, 5-minute treatment on his brain. And I just did some light chiropractic stuff on his spine behind him when he was sitting, just to activate those special nerve endings that fire into the brain. 3 times a week for 4 weeks. His symptoms were 70% better in 4 weeks, to my surprise and their surprise. He did really well. But he had work to do, so we kept at it. We worked twice a week for 4 more weeks, and he was 90% better. All of his symptoms were 90% better, with the exception of his broken collarbone ribs. Actually, his ribs were getting better too. And we also did laser his ribs, and we were lasering his clavicle for tissue mending and pain relief and so forth. So we did really well. He was back to full-time work. He was back to driving, back to walking. His memory came back and so forth. Now he's doing really well. But that was a pretty tough case. So we have one auto accident case, brain injury. Second one, fall down a flight of stairs. Here's the third one. This was an 18-year-old woman who was skateboarding in October of 2021. She fell off her skateboard, hit her head. She lost consciousness not very long. She doesn't remember the fall or immediately afterward. She slept a lot that night, had a mild headache, had some neck pain, and so forth. So she came to me pretty quickly, and we started her off with laser. Okay. Through a couple of things, she also injured her foot. I recommended that she go get some x-rays and so forth. She had a broken bone in her foot as well, so now she's walking around in a boot. But she had light sensitivity, sound sensitivity, couldn't look at a lighted screen very long, definitely focus and concentration issues. She was in college, had to put that on pause because she just couldn't handle the coursework and so forth, common after that. So we just put her on the same thing. We put her on the brain protocol for laser. I did my chiropractic work and so forth, and she did really well. In 2 months, all of her concussion symptoms resolved. 2 months, so she did really well. That was case number 3. And case number 4, a 36-year-old man came to me after a concussion in hockey, 36 years old. So if I remember the situation correctly, so most of the adult leagues in hockey are no check. You bump, you fall, and so forth. One time he fell, and on his way down, he hit his head off the knee of another player. By the end of the game, he was throwing up. So he had a concussion, right? And I called him, and so I knew about the concussion. I called to check on him. He says, "I'm still not doing good." And this was a month later. He says, "I can't work, I can't focus, I can't concentrate," and so on and so forth. And this was 2016. So I said, "Hey, I have a laser. I could try that out if you want." Sure, it comes in. And I remember that. I remember this now. So I did a laser protocol for him. I think it was just 3 minutes, right? Sent him home. Comes in the next day. He says, "Oh my goodness, whatever you did, please do it again." So he noticed an improvement after 1 month of suffering. I lasered him 1 visit, and he could detect an improvement on how he felt. That was pretty cool. I will not make any promises that you will come into me if you're after a concussion or mild traumatic brain injury and I do 1 laser treatment on you that you're going to have a noticeable result. I will not promise that. But it just happened to be in this case, that's what he noticed. So we put him on the protocol. I did my spine work. I did the concussion. I gave the whole list of stuff. We worked on the nutrition and the water and the sleep and the ramping up slowly on the exercise. He had already tried exercising and he went a little bit too hard, had a regression of symptoms. He had to back off. He figured that out before he came to see me. So I had to pull in the reins a little bit and make sure he graded his exercise up more slowly. Let's see. So that was November of 2016. Through December into January, so it looks like about 2 months later, his concussion symptoms resolved, and then he was back playing hockey and skating at full intensity. The bummer for him was 3 years later, he had another hockey incident, a little mass-to-mass collision, got some concussion symptoms, but this time he didn't wait. This time he called me immediately. We put him right on the laser, got him going immediately, and within a month, he recovered from the second concussion fairly well. So those are four cases. There are others, but those that I just picked out that we did pretty well with our protocol that we talked about earlier on navigating people down the road, and particularly in the cases with the caretakers. I found it really important, and this is another data point for you all. If you have somebody that is having memory issues, short-term memory issues, cognitive issues from concussion, and so forth, just make sure that somebody near them is helping them to follow this protocol, right? Getting the water in, making sure they're eating vegetables, getting to bed on time, limiting lights and lighted screens and so forth. So some people need assistance in getting all these things done. Just keep that in mind. Before we're done here, I just want to pop a couple of articles to you that talk about how we came up with these protocols. And you can look these things up online. I'll have them in the show notes too. This is a great article in 2012 out of the journal Physician and Sports Medicine. The title of the article is Post-Concussion Syndrome, a review of pathophysiology and potential non-pharmaceutical approaches to treatment. Wow. Joseph Maroon, medical physician, is the lead author on this article, well with others. And by the way, Dr. Russell Blaylock is in this article. I've talked about Dr. Russell Blaylock on this show in the past. Just a couple data points on this article here. The incidence of all-cause concussions in the U.S. is 1.6 to 3.8 million annually. In here, he talks about a lot of protocols that can be utilized to fight the inflammatory cascade that happens after concussion. Here's the point I wanted to tell you. A number of natural plant products and extracts, such as fish oil, resveratrol, green tea, and curcumin, among others, may offer similar effects in treatments of brain injuries and Alzheimer's disease with other neurodegenerative disorders. So not only can these products be used that we talked about earlier on concussions, but they can be used in other neurodegenerative disorders. That's pretty cool stuff, okay? Then he talks about omega-3s, as I mentioned to you earlier, resveratrol, magnesium, green tea, and so forth. Great little article. Next one is just going to read you the title, Brain Photobiomodulation Therapy. Photobiomodulation therapy is laser on the brain. It's using red to near infrared light is an innovative treatment for a wide range of neurological and psychological conditions. This is out of the journal Molecular Neurobiology in 2018. There are other articles on laser for the brain, but I just wanted to mention that one to you, so it's so cool to actually mention what we're talking about here. Therapeutic use of omega-3 fatty acids in severe head trauma. This was an article that talked about a coal miner who survived a blast but was in a coma. They fed him through a feeding tube 15 grams, 15,000 milligrams of omega-3s for a period of time. 21 days later, he was weaned off the ventilator. There was another article in here about another case of a 17-year-old sustained a severe traumatic brain injury after being ejected from a car in a coma. They did 20 grams of fish oil and 50,000 international units of vitamin D. And after being in a coma, by day 3, she was able to follow simple commands, able to return to school 3 months later after being in a coma. This was from an article called Functional Medicine Approach to Traumatic Brain Injury out of the journal Medical Acupuncture in August of 2017. Again, with concussion and mild traumatic brain injury, it's very complex, but these are some simple tactics that I use in my office to try to help people. I'm Dr. Scott Fuller.